People have issues or misconception about health insurance. They've been buying drugs and drugs and drugs. The more you know, the better you become in the health insurance ecosystem. Hello, my name is Shola Kande, the Executive Secretary of State Health Insurance Agency, running the Oyo State Health Insurance Scheme. So there's some few points that I want to quickly talk about this afternoon, which are germane to the enrollment of residents of the state into Oyo State Health Insurance. Of course, germane to everybody listen to me. The more you know, the better you become in the health insurance ecosystem. And so people have issues or questions or misconception about health insurance vis-a-vis pre-existing illnesses. Pre-existing illnesses or pre-existing events are things that we have in our body, or sicknesses, one sickness or the disease that we have in our system or that we are nurturing, or sometimes can be a surgical intervention that we are trying to raise fund for. And so what happens most of the time is that people with pre-existing illnesses, which is normal actually, are always first respondents to marketing, an health insurance policy. Understandably so, because you know that either a doctor has given them a bill, or for chronic illnesses, for example, they've been buying drugs and drugs and drugs. So when you say, for example, premium for an health insurance is 13,500, they want to rush in because, of course, that appears like a good bargain. However, common points that I want to highlight this morning is insurance actually is made for us to come in before we have any issue. We buy insurance when we're healthy, when there are no illnesses, when there are no sicknesses, when there's no need for surgery, even when there's no pregnancy. That is the ideal way to actually come on health insurance. And so if you've been on insurance for a year or 2 or 3, and then an illness or a pregnancy or a challenge or a need for surgery comes, your premium which you've paid, will be enough to cater for the treatment of such cases or illnesses, as the case may be, that I mentioned earlier on. Number 2, if you've had an illness and then you want to come in to buy the normal premium, that will look like you are cheating, or you want to cheat on people that have been subscribing to insurance over a period of year. Even some have never used it, possibly beyond their basic medical checkup. And so when you have pre-existing illness, you cannot come in, at the normal premium that has been prescribed. The other way you can manage that, so that will take me to point number 3, is to say that if you have a pre-existing illness, then you can approach an health maintenance organization to buy a tailor-made plan for that illness, or to take care of that surgery that you want to do. That is a way to manage pre-existing illness, on health insurance. The other thing you can do is some state-supported health insurance agency have top-up plan. So every state agency is selling a universal health coverage plan. In Oyo State, for example, it's 13,500. That's our universal health coverage plan. And then you have some other top-up plan to be able to allow people with pre-existing illness to enjoy health insurance. Now, the philosophy behind is that in universal health coverage, you are leaving no one behind. Everybody must have an opportunity, to get into insurance. So there's a top-up plan for people that have a pre-existing issue. I've defined pre-existing issue earlier on: a disease, need for surgery, chronic illnesses. So if you want to come in, you will not come in on the normal premium, of the agency. Like I've said, a way is you have a tailor-made plan. So another way that I'm mentioning now is you can buy a top-up plan. In Oyo State Health Insurance, for example, we have a top-up plan for people that have pre-existing issue or pre-existing event or pre-existing illnesses. I use those words because pregnancy is not a disease, so we call it a pre-existing, event. So if, for example, you've taken in, you are pregnant before you want to come into insurance, doctors have made a diagnosis, doctor have prescribed to you a need to do a surgery, so when you want to take opportunity of health insurance, then you come up on a top-up plan of 50,000 or 108 plan, 50,000 per annum, 108,000 per annum. Even at that, there are some other conditions that are attached. For example, if you are coming on any of these top-up plan, 108 or 50,000 plan, you will have to wait, for about 3 months or thereabout to be able to get that surgery done. So it's not that, of course, they make a diagnosis that you need to do a surgery and then you come in top-up plan and then tomorrow you are asking that the surgery be done. So there's still a waiting period before the surgery can be done. Meanwhile, you can enjoy all other benefits on the top-up plan, 50,000 or 108, before the surgery comes. I.e., actually you come in so that you can do the surgery. While waiting for the surgery, you can treat malaria fever, you can treat some other form of health challenges before the surgery can be done. Not only that, this especially for pregnant women, we always say that come buy insurance before pregnancy comes. The moment pregnancy comes in, you cannot use or come on a 13,500 premium. You have to come on a top-up plan of 50,000. Even at that, we don't take pregnancies that are beyond first trimester. That is for ethical purposes. So when you are pregnant and you want to come on top of your state health insurance scheme, make sure you come within the first trimester. The best is for you, a lady, actually to come on insurance before pregnancy comes in. The moment there's pregnancy, and that's probably the time you are hearing of your state health insurance scheme or somebody is encouraging you, make sure it's within the first trimester. Outside first trimester, even whether you want to do 108 top-up plan, whether you want to do 50,000 top-up plan, we are not going to allow you, except you will sign an undertaking that your pregnancy at that year of enrollment, will not be cared for under insurance. So these are dynamics, because I know that a lot of people ask questions, phoning on TV, on radio, to seek this clarification. I think I've been careful and slow enough to be able to, explain that. So enroll 13,500 per life under your state health insurance scheme. Enroll family plan of 4 or family plan of 6. Family plan of 4, you can enroll at 47,250. Family plan of 6, that is 60,750 naira. These are our universal health coverage plan. That is what we are pushing, so that you will not come up on top of plan. So if you got in before there's any ailment, that is what insurance is all about. So we populate the pool. So peradventure, any one of us that is in the pool will take ill, then you can go to your own nearest hospital. You have an opportunity to choose any of our 450 accredited hospitals spread across Oyo State. It can be primary care center, it can be a general hospital, it can be a private hospital. You have an opportunity to change your hospital about thrice, in a year. If the first hospital you are not so happy, then you can change out the hospital. And I want to encourage all our enrollees that sometimes we have issue on delivery side. Probably you go to your hospital and you are not so happy. Sometimes you expect more than what they've done. On your ID card, there's a number you can call. Our call center number, is there for you to use. Our call center is 07000697. It's open 24 hours. So that you can lodge complaint. Sometimes you can just send in thank you if you enjoy our service or services, and if the service is below par, give us a feedback. But if you have pre-existing issue, which I have spoken about, you come in on either 50,000 or 108 plan. So I encourage you, like I always say, I want to round up again, head or tail on insurance, you win. OYSHIA Day, Ìrọ̀rùn Ọ̀yọ́ Day. Thank you.